Hello, good morning, good afternoon, good evening. I'm Tom, and I am going to give you a demo today of Tom's Heart. It's an application that I've written after suffering a heart attack about 4.5 years ago. So I had a heart attack and a cardiac arrest. And if you're like me, after you have an incident like that, you have a lot of questions. So many questions. Perhaps starting with medicine. I'm on a number of medicines. Do I need to be on these medicines? How long am I going to be on these medicines? I'm on Lipitor, metoprolol. Do I need to be on these medicines? How are they going to impact me generally? And how often do I need to take them? How often do I need to see my doctor? What kind of tests and procedures do I need to get EKGs done? Do I need echocardiograms done? How often do I need those to be done? Perhaps you have questions around mental health. I'm not feeling well. I'm melancholy. Or just generally, how long is it going to take you to recover? When am I going to feel myself again? So this is why I've created an application that's a mobile app. So it's essentially a healthcare heart attack personal recovery advocate that's in your pocket. So it's an AI-based application. Think of like ChatGPT. That's in your pocket, but it's taking data that is specific to heart attacks and heart attack recovery. And Tom's Heart is actually based on data, public data from the American Heart Association. So I've curated information on their website. They have infographics, which contain pictures as well as text. They have videos and audio available, and a plethora of content available across all the different spectrums of your heart recovery. So whether it's physical health recovery, mental health recovery, psychology recovery, eating and diet, exercise. There's about 11 different categories and different elements of this application, but we're going to focus on 5 of them today as I walk you through this demo. Not to get into too many different varieties in different areas, but what I'm going to do is I'm going to cover 5 specific ones, and I'm going to show you the demo of this application. So let's switch over to the application itself. So as you can see, this is a mobile chatbot application residing on my Android device, and I can ask this application questions. Right now, there's an avatar on here called Lucas, and Lucas is sort of like my personal advocate for everything. They're like a general advocate. And then you have avatars or individuals that are actually behind these avatars for each of the different areas. So say if it's like exercise, you have an avatar for exercise. Say it's like for diet, you have an avatar for that. Or medicine management, you have an avatar for that. So what I'm going to do is I'm just going to ask Lucas a general question about my recovery. Hey Lucas, I have a question about what kind of damage could possibly have been done to my heart when I had the heart attack.
After a heart attack, there can be various types of damage to the heart muscle, including weakened areas, scar tissue formation, and reduced heart function affecting how well the heart pumps blood. Diagnostic tests recommended by the AHA can help to assess the extent of the damage. Would you like to discuss these diagnostic procedures and tests with Edward, the expert sidekick for physical health?
As you can see, Lucas, if you want to drill down further, you want to get more information, you can pass me off to Edward, who knows a lot about physical health recovery. Instead, I'm going to ask another question to Lucas. So, hey, Lucas, I'm just curious, like what can I do to prevent another heart attack, another incident to happen to me?
To help prevent another heart attack, consider focusing on lifestyle changes, stress reduction, and regular monitoring of your heart health. I recommend exploring the content library item How Not to Have a Heart Attack which shares valuable experiences and best practices. Would you like to work on this item with Alice, the expert sidekick for this topic?
Now, it's interesting here because how not to have a heart attack is actually a blog post that I wrote that is publicly accessible that I've loaded into this application, that I've loaded into this repository of content. So it actually takes content from the American Heart Association as well as content that I've loaded in here that's my personal heart attack recovery story that you can read about and listen to. I'm going to ask Lucas another question here about having a cardiac arrest. Like, Lucas, what's the potential for me to have another cardiac arrest? What kind of risk am I under for having another cardiac arrest?
The risk of experiencing another cardiac arrest can vary based on several factors, including your current health condition, lifestyle choices, and adherence to medical advice. It's crucial to work closely with your healthcare provider to understand your personal risk and make informed changes to your lifestyle and health management strategies. If you're interested, I can connect you with Edward, the physical health expert sidekick, who can offer more insights tailored to your situation. Would that be helpful?
I'm going to ask another question here in the recovery section, then move on. Hey, Lucas, I am curious, how long is it going to take for me to feel normal again? Like, I've been in this recovery stage for, say, 3-4 months. Like, when am I going to start feeling myself again?
Recovery after a heart incident can vary for each individual and is influenced by factors such as the extent of the heart damage, your adherence to rehabilitation programs, and lifestyle changes. While some people start feeling better within a few months, for others, it might take longer. Regular follow-ups with your healthcare provider and participating in cardiac rehabilitation can significantly aid your recovery process. Would you like to explore a content library item focused on post-heart attack recovery or rehabilitation options?
I'm going to ask Lucas a couple of questions around my physical health and actually a continuation of where Lucas offered up for me to learn more about follow-up test procedures. So let me ask this question. Hey, Lucas, I'm curious. Earlier you mentioned different tests that might be performed on me after a heart attack. Could you name me some of the procedures and tests that I might expect after my heart attack?
After a heart attack, some common diagnostic tests you might undergo include electrocardiogram, EKG, to measure your heart's electrical activity, echocardiogram to assess the heart's pumping action and structure, cardiac MRI for detailed images of your heart, stress tests to determine how your heart performs under physical exertion. If you're interested in a more detailed overview of these procedures, I can connect you with Edward, the expert sidekick on AHA heart diagnostic and procedures. Would you like me to do that?
Lucas, I have a question specifically around EF. I heard the term EF when I was in the hospital, so my ejection fraction. What does that mean and what's a good range for that?
Ejection fraction, F, measures the percentage of blood the heart's left ventricle pumps out with each contraction. A normal F is typically between 50% and 70%. Values below this may indicate a weakened heart muscle, common after a heart attack. Would you like to explore more about how this relates to heart conditions with Edward, the expert sidekick on physical health?
I'm going to ask some questions, a couple of questions around medication. Lucas, I'm on a number of different medications, Lipitor and metoprolol. How long will I have to stay on these medications?
The duration for which you need to stay on medications like Lipitor, a statin, and metoprolol, a beta blocker, will depend on your individual health condition, medical history, and your doctor's guidance. These medications are commonly prescribed for long-term management of heart health to help reduce cholesterol levels and control blood pressure. It's important to regularly consult with your healthcare provider to assess your progress and management plan. Would you like to know more about medication management with Jamal, the expert sidekick for this topic?
Lucas, I have a specific question around Lipitor. I've read some things on social media and seen some advice from doctors out there that Lipitor isn't necessary for me to take. What's your take on Lipitor?
While I can't provide medical advice, Lipitor, a statin medication, is commonly prescribed to lower cholesterol and reduce the risk of heart disease. It's important to rely on information from your healthcare provider, who understands your specific health needs. If you'd like, I can connect you with Jamal, the medication management expert sidekick, who can offer more detailed information. Would you like to connect with him?
I'm going to ask Lucas a couple of questions around eating better, and then we can wrap up this demo. Lucas, what food should I avoid after my heart attack? What are some foods that are probably going to hamper my recovery?
After a heart attack, it's generally recommended to avoid foods high in saturated fats, trans fats, cholesterol, sodium, and added sugars, as these can hamper heart recovery. Processed foods, deep-fried items, and sugary beverages are typically discouraged. Would you like more detailed guidance on heart-healthy eating? I can connect you with Trudy, the expert sidekick for healthy eating.
Lucas, how about beer? Can I have a couple of drinks at night, a couple of beers? I mean, is that fine?
After a heart attack, it's generally advised to limit alcohol intake to support heart health. Typically, moderation is key, which may mean up to 1 drink per day for women and up to 2 drinks per day for men. It's always best to consult your healthcare provider to understand what's appropriate for your specific situation. Would you like more guidance on heart-healthy lifestyle adjustments?
As you can tell, you can ask a variety of questions. And I stayed with Lucas, so he's this generalist that can answer questions. And then I did not delve in. What I'm going to do in subsequent demos is take each of these areas and really delve into like medicine and show you some of the responses you can get and actually take up Lucas's sort of suggestion or recommendation to talk to one of the avatars, one of the individuals that's specific to that area. So like I said earlier in the conversation, this is based mostly on American Heart Association data, though I was welcome to see that my blog post that I placed in the repository is there for people to read. Also wanted to point out that I am working with a company called Sidekick Wellness to create this chatbot. So they have the technology, the AI platform behind this, and I'm working with an organization called Champion the Challenges, which focuses on stroke. So we're going to generate a heart stroke application. We're actually working with the American Heart Association and their AAH challenge for this year to produce technology utilizing American Heart Association data, both public data and private data. So in the near future, in a few months, we'll have an application that will support both heart and stroke, as well as utilize the AHA private repository of data to be more specific and give you more granular information. Thanks a lot for listening, and I hope to talk to you all soon. Bye now.